Hello, I'm Mabel Jong, and I'm sitting here now with Dr. Lauren Thompson, who is with the Office of the National Coordinator for Health Information Technology. Dr. Thompson, thank you so much for your time today.
Oh, you're quite welcome. Thank you for inviting me.
You've just unveiled some open source software that provides information sharing while promising patient confidentiality and privacy. How does that all work?
Well, the Connect software, the Connect is a software gateway. It's been developed with open source software. It's open in the community of developers. It's actually been in development and out in the marketplace for a couple of years. We've just released a major new release though, Connect version 3.3, that puts into place some very significant capabilities for the participants in the Nationwide Health Information Network Exchange, which use the Connect software.
I understand a number of agencies were involved in the development of the software.
Yes,
why was that important?
Well, it was important because and very significantly, Department of Veterans Affairs, Department of Defense, who are engaged in a program called the Veterans Lifetime Electronic Record Initiative, the Social Security Administration and Centers for Medicare and Medicaid Services are all participating. There was a need for each agency to find a mechanism to securely exchange patient data with one another as well as with their private sector healthcare providers. So they came together under the umbrella of the Federal Health Architecture Program to contribute funds towards development of the Connect Gateway. So over a period of the last 2 to 3 years, development has been put into developing a secure mechanism to exchange data among the participants in the exchange.
Can you give me an example of how life was before this software and what it is like now? What can we expect? What kind of changes?
Before Connect, paper-based. Faxes, handwritten notes. It's really tied into the proliferation of electronic health records among hospitals and providers' offices. And essentially, a provider can pull off our website, the Connect Gateway software, install it in their physical location. They do need to sign what's called a DURSA, a Data Use and Reciprocal Services Agreement, that essentially is the trust fabric. Essentially, they're agreeing to participate in the exchange and abide by all the security and privacy rules. There are some security mechanisms implemented in the software itself, but it is a requirement for participation that an organization sign this agreement. So once they've signed it, they onboard into the exchange and go through a process of ensuring that they are meeting the security and privacy requirements. And once they are approved for that, they are able to share data with all members of the Nationwide Health Information Network Exchange.
And overall making the system more efficient, you believe?
Absolutely, making it more efficient, more effective, significantly saving dollars, enhancing patient care. We've had instances where patients have come into an emergency room with allergies or other significant events, and because physicians can tap into the electronic health records using the Connect software, the Gateway software, they're able to identify risk areas for the patient. So there have been instances where patient lives have been saved.
Terrific. All right, Dr. Thompson, thank you so much for your time today.
Thank you.
I'm Mabel Jong. Thanks for watching.